Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Life planning. Introduction. Most of us plan for the best possible life, which is living well with peace of mind and without crisis. We plan for the major events in our lives such as careers, vacations, weddings, retirement, and other important life events. The one event most of us put off planning or thinking about is the final chapter in our life. When we make end-of-life plans, we think about what we want to do, the right thing to do, and how to make the plan a reality. This is called life planning. Many of us will talk about our plans with someone that we trust, like a family member, loved one, or a close friend. When we talk about plans, our family and friends know what we are thinking. They know about our dreams, values, and desires. Sometimes we may need their help to fulfill our plan. Good life planning is important. Learning about how to plan for this important time can empower you and your loved ones to choose the best options and make decisions that will give you the best quality of life. This program will help provide you and your loved ones with the necessary information to start thinking about planning for life's final chapter. It will help you think about the questions that you should discuss with your healthcare team members, care options, and other alternatives. Who should plan? We tend to think that life planning is only for people who are terminally ill or whose death is about to happen. However, life planning is for the young and the old in any situation. Healthy people should consider planning. Accidents or unexpected events can happen. For instance, the healthy person who goes to work or a social function and is badly injured in an automobile accident, or a healthy factory worker who experienced a tragic accident on the job. People with chronic diseases should consider planning. People with chronic, incurable diseases go through periods of slowly declining health. They experience sudden, severe episodes of illness that require hospitalization and then recover. This is a pattern that keeps repeating. In people with some chronic diseases, their health steadily declines until they die. Examples of chronic diseases are heart disease, chronic obstructive pulmonary disease, COPD, stroke, dementia, kidney disease, and old age. People hospitalized for a health crisis resulting from chronic disease receive medical treatment that cannot cure the illness. Instead, treatment may resolve the immediate emergency and possibly extend the patient's life. Any one of these crises could bring the patient close to death, but there is no clear way to identify when the patient is very ill and actually dying. Terminally ill people should consider planning. Terminally ill people tend to have a more predictable course of dying. For instance, people with terminal cancer usually follow an expected course of dying. Many maintain their activities of daily living until about 2 months prior to death. Then they start to become weak and have difficulty functioning. Thinking about your plan. It is important to take the time to think about your attitudes, beliefs, and feelings about living. What does quality of life mean to you? Once you understand what quality of life means to you, you are ready to think about your attitudes, feelings, beliefs, and values about death and dying. You will be able to better decide how you would like the last chapter of your life to end. You should ask yourself what kinds of treatments you would want if you could not speak for yourself. Some questions you should consider when deciding on what you would like to plan are, what are your values and beliefs? Are you religious and seek spiritual care? Consider these questions. 1. What if you couldn't walk or talk because of an illness or accident? 2. How would you feel? 3. What would your life be like? 4. Could you do the things that you enjoy doing? Imagine that you have not thought about the answers to these questions. What happens? 1. When you become ill and cannot speak for yourself. 2. Who will speak for you? 3. Who really knows what you want? 4. Who do you trust to speak for you? Once you know, or think you know, what you would want done if you become seriously ill, you need to start talking about these wishes. Talk with your family, a close friend, and your healthcare team. Have the discussion with different people that you care about and respect. This is important because everyone has different ideas about what is right for them. Talking with different people can help you choose the best person to speak for you in a time of crisis, or if you cannot speak for yourself. This person you choose is known as a surrogate. People may not want to talk about your wishes or the idea of death and dying. Let them know that this is important to you. It is important for you to express that you are serious about your wishes. Talk with the person that you think may be able to honor your wishes. Ask them if they are comfortable speaking for you. Many times we decide who we want to speak for us but never let them know. Sometimes we let the person know, but when the time comes for them to speak for you, they have a hard time honoring your wishes. This may be because those are not their beliefs or values. Expressing your wishes for a time of crisis may provide comfort for your family and friends because they know that they have honored your wishes. Medical technology can extend life and cure many diseases. It can mean difficult choices for patients and their families. You may feel confused about the choices for certain medical treatments. You may fear that the treatments will be painful and expensive. You may fear that you will not receive the care you need. As your health declines, medical decisions become more difficult. Do you or your loved ones know what treatments you will want at the end of life? Things to consider are the patient's age, the type of illness, the treatment options available to keep a person alive, and the emotions families endure when their loved ones are sick and possibly dying. When a person is seriously ill and may be nearing the end of life, the person and their family sometimes find it difficult to decide on whether or not to continue medical treatments. Many times the person does not know how much treatment they want or for how long. Usually, in these situations, patients rely on their family, loved ones, physicians, other trusted healthcare team members, or spiritual advisors for guidance.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Treatment options and choices. The Patient Self-Determination Act is a law passed by U.S. Congress that guarantees a person the right to accept or refuse treatment and to complete advanced directives. It is important to understand some of the life-sustaining treatment options that may be available to you. Understanding what medical technology is available can help you clearly decide and communicate your wishes. Some treatments help some people live longer or feel better. For some people, treatments do more harm than good or are not possible because a person is too sick. Cardiopulmonary resuscitation, also known as CPR, is performed when the heart stops beating or slows down severely. It involves applying force to the chest to compress the heart. CPR may also include electric shock to the heart, medications, and a tube inserted into the lungs to help with breathing. CPR can benefit healthy people, but is usually not helpful for people who are seriously ill. It can cause broken ribs or punctured lungs. Even if the heart is started again, the brain can be damaged by lack of oxygen. Older patients and those with serious illnesses often lose physical and mental ability even if the heart is started again. CPR may or may not work. Survival after CPR depends on a person's age and health. Statistics show that only a few elderly people with multiple medical problems survive CPR even when it is done in a medical facility with life-saving equipment and trained personnel. If your heart stops, you can decide if you would like treatment. If you would not like treatment, you can choose a DNR, Do Not Resuscitate order. A DNR means that you do not want any extra treatment to be used if your heart stops. Examples of extra treatments are electric shock to restart your heart or a ventilator, a machine that breathes for you. When the kidneys can no longer take care of a body's needs, dialysis treatments may help. The kidneys remove waste products, salt, and extra fluids from the body. For people that have kidneys that are damaged or fail, dialysis replaces a small portion of the kidney's function. Dialysis can improve or at least support a person's current quality of life. Dialysis is necessary for a person with chronic kidney disease to remove waste and keep the body fluids and chemicals in balance. When your kidneys fail, known as end-stage renal disease, you need to have dialysis to filter your blood. Some people decide to have dialysis. Some people choose not to have dialysis. You may have other health problems that make dialysis hard to do or might not tolerate dialysis. You may start dialysis and then become tired of the treatments, deciding that you just want to be comfortable. You have the right to end these treatments anytime you want. You can also choose to take medication but not have dialysis treatments. IV fluids provide hydration when you are unable to drink enough fluids. They are given through a needle that is placed in a vein. You can also receive nutrition into your bloodstream through an IV. This is known as total parenteral nutrition, TPN. It can provide many benefits and is usually appropriate for most people. It helps you stay nourished and can speed up the healing process, particularly after surgery. If you can no longer take food or fluids by mouth, you can receive liquid feedings, water, and medications through a tube. The tube can go down your nose into your stomach or can be placed directly through the skin into the stomach. These feedings can help people who cannot swallow but are expected to get better. Tube feeding can cause pneumonia and may result in swelling and infection. Tube feeding can increase bloating and discomfort. You can choose to have an IV and tube feedings. Without needed IV fluids and tube feedings, your body will slow down naturally. As people near the end of life, their need for food and fluid lessens, and most likely they will not feel hungry. If you are able, you may want to eat what you can by mouth. Medications may be used to control heart rate and blood pressure, or to reduce anxiety and pain. Antibiotics may be given to fight an infection. Sometimes you may receive these medications through an IV line. Ventilators are mechanical machines that breathe for people. It is a life support machine that helps you to breathe if you can no longer breathe on your own. The machine provides oxygen to your lungs through a tube. The tube enters your mouth and goes down your throat to your lungs. A ventilator or respirator may be necessary as a temporary measure to help you breathe and recover from a medical emergency that is not related to your illness. Usually you will need to be fed by a tube in your stomach when you are on a ventilator. You may feel that being on a ventilator would prevent a natural death or keep you alive longer than necessary. You may feel that being on a ventilator will extend your life and give you time to say goodbye to your loved ones. How medical decisions are made. Healthcare teams make treatment decisions based on a patient's condition and their request for treatment. Usually, the goal of medical care is to help people get better. Treatments like a ventilator or dialysis may be used temporarily until healing can happen. It is necessary to gather current information about your diagnosis and overall condition, realistic and appropriate goals, your comfort level, your medications and treatments, your current wishes or previous wishes if you are unable to speak, additional treatment options, including the benefits and burdens of each. Usually the patient, the family, and the physician discuss treatment options. This includes the length and invasiveness of treatments, chance of success, overall prognosis, and the patient's quality of life during and after the treatment. As the patient's condition changes, these discussions should continue. These discussions cannot be held with a patient if the patient becomes incapacitated due to illness or an accident. In this circumstance, the patient's family and physician must make decisions based on what they think the patient would want. When a patient becomes too sick to speak for themselves, decisions about which treatments to provide or withhold are usually made jointly between the patient's physician and family or surrogate. Decisions. There are many treatment options available. It may be hard to figure out how to choose what is right for you. Thinking about your values and deciding what is right for you is the first step in the planning process. It is important to take the time to talk with your family, friends, and your healthcare team about your preferences. The next step is to choose the best person to speak for you in a crisis when you are unable to speak for yourself. Choose someone who has similar beliefs and values that you think would be comfortable speaking for you. Talk to them and ask if they would be willing and comfortable speaking for you. Should you choose someone who does not have the same value system, talk to them and make sure that they will be able to follow your wishes. You may choose to have all or some of these life-supporting treatments for a limited time, such as days or weeks, to see whether your condition improves. You may decide that you want only certain things done to keep you alive. You may decide that you want nothing but to be allowed to die a natural death. The choice is yours. Ways to make your wishes known. Whatever you decide, it is important that you make your wishes known and have them written down. Advance directives are legal papers that tell your doctors and other healthcare professionals how you want to be cared for at the end of your life. Make sure that your doctor has a copy for your medical record and that you give a copy to a family member or friend. A do not resuscitate, or DNR, is a medical order to not try resuscitation. It allows you to have a natural death. A DNR asks that no heroic treatments be used if your heart stops. Heroic treatments are electric shock, also known as defibrillation, to restart your heart, or a machine, also known as a ventilator or a respirator, to breathe for you. A living will explains your wishes if you are in a coma or cannot speak. It will tell the doctors and other healthcare professionals what treatments to use or not use to keep you alive. You must have 1 or 2 witnesses or a notary present when you sign this form. A durable power of attorney for healthcare allows you to name a person to make decisions about your care if you cannot speak for yourself. People usually ask a family member or close friend. Make sure that you talk to the person that you name about the treatments that you want or do not want. Make sure that the person understands what you want and can carry out your wishes. A POLST, Physician Order for Life-Sustaining Treatment, is a form that clearly states what kind of medical treatment that you want toward the end of life. Any of these options allows you to have more control over your treatment. It is important to have a discussion with your healthcare team to understand what is available to express your wishes, as the options may vary by states. You should decide on how often you want to review these documents, or wait until you become ill or your condition changes. If you decide to review your options regularly, keep a schedule. Make sure to keep your healthcare team and family informed of your wishes, particularly if they change. Resources. There are many resources available to help you understand your treatment options so you can make decisions that you feel are right for you. Sometimes a cure is not possible and medications and treatments can't help a person. Treatments can be painful and expensive. If you are feeling overwhelmed, frightened, and don't know what to do, there are people you can talk to who can help. You may be undecided about what you want to do, or, if you are ill, you may have decided to stop all treatments. Talking about your choices with members of the healthcare team is important. Some people find that spiritual counselors can help with spiritual and emotional needs. They can help you and your family talk about their feelings and better understand them. Ethics committees can help to explain the available treatment options and what they mean to you and your family. They will not make decisions for you, but help you and your loved ones to understand the options available. This can be very beneficial when members of your family do not agree with your choices. Social workers can help to explain the different treatment options and documents, as well as answer any questions about finances. They know what forms are needed to express your wishes. This is important because each state has different laws and options. They can help you with getting the forms completed. Palliative care is care for people who have advanced serious illnesses. It involves a group of trained professionals, doctors, nurses, and social workers. They are available to discuss the challenges that come with having a serious illness. These illnesses can be overwhelming, and the palliative care team can help you to understand what is happening to your body, the care options available, and the pros and cons of the decisions that you could make. The goal of palliative care is to improve a person's quality of life, not just in the body, but in the mind and spirit. Palliative care can be combined with other types of treatments. Palliative care can help to manage symptoms, pain, or side effects from treatment. Palliative care can help you cope with your feeling about living with a serious illness, and may even help with planning for future health and medical care. Palliative care can help a person of any age, whether or not the illness is terminal. Hospice care provides medical services, emotional support, and spiritual resources for people who are in the late stages of an incurable illness, such as cancer, heart failure, or end-stage renal disease. They help family members manage the practical care and emotional challenges of caring for a dying loved one. The hospice team members are health professionals, volunteers, and spiritual advisors. They provide basic medical care, medical supplies, and equipment as needed, focusing on pain and symptom control. Counseling and social support is available as needed for the person in hospice care and anyone in the family. They provide guidance with the difficult but normal issues that come with end-of-life care.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Planning and preparing for that final phase in your life is very important. Once you have decided what you want, you must choose the person who will carry it out for you. Make sure it is someone who knows who you are, what you think, what you want, what your choices are, and what your beliefs and values are. Choose someone that you know you can trust to carry out your wishes no matter what. Information and good life planning could allow many people to avoid dying alone, in pain, and in unfamiliar institutional surroundings. Many families can avoid regrets and unresolved issues by having and following a plan for end-of-life care. Make sure that you have these conversations with members of your healthcare team and that they know what your wishes are. It is important that it is written down and that your healthcare team knows where to find this information. This will help the healthcare team to support you and your family by respecting your wishes because they have an understanding of your beliefs and spiritual and cultural values. Thank you for using Explain.